The purpose of this lab activity demonstration is to show the effects of tobacco smoke on blood pressure. Blood pressure is a measurement of the elasticity of artery walls. The resistance between the wall and the blood flowing through while the heart is resting is diastolic tension, and the resistance between the wall and the sudden surge of blood sent through the vessel when the heart contracts is systolic tension. So what we'll be measuring is what is called diastole and systole pressures. Systole is when the ventricles contract, and diastole is the resting blood pressure. An easy, well-known technique for measuring blood pressure is by using the stethoscope and sphygmomanometer. In our view here, I've now panned back so that we can take a look at those two pieces of equipment. The stethoscope here is made up of the earpieces, which are placed one in each ear, and the diaphragm. In this case, the diaphragm will be placed in this position on the arm to listen to the change in diastole and systole blood pressure within the arteries of my arm. Now, how do we measure this change is on this meter here. And let's take a close-up look at the meter. And it reads from 20, and it goes around to 40, 60, 80, 100, 120, 140, 160, 180, 200, all the way continuing around to 300 millimeters of mercury. Now, what the numbers actually mean is this: how much pressure it takes to raise an amount of mercury, which is an element, to a height of, if it said 100, to a height of 100 millimeters, or to a height of 120 millimeters, or to a height of 140 millimeters. Or in the case of this dial, it could measure all the way up to the height of 300 millimeters. That's 1/3 of a meter. Now, how do we separate diastole and systole? Well, that's where the cuff for the sphygmomanometer comes in. The cuff here will go around my arm and then I will read this label to position in this area right here the diaphragm of the stethoscope. Now, to show you what that looks like, I'll slip the cuff on my arm. You can now see that it is on my arm, and then I would place the diaphragm approximately here, opposite my elbow. I'll inflate the cuff to stop the blood flow, then slowly let the air flow out so that I can measure my blood pressure, the resting blood pressure as well as the ventricle contraction blood pressure. So first off, I'll put the stethoscope on so that I can check my blood pressure. Then I'll place the sphygmomanometer cuff on my arm. There is a bulb here that I can use right here to inflate the cuff. To get a reading. Again, I'll use this dial here, this one here, to take the reading. The first reading will be diastole, and it should be a smaller number. The second reading, now I'm beginning to inflate the cuff around my upper arm to constrict the artery flow. You can see the meter is starting to climb. And I'll go up to about 140. And then listen now as I'm going to slowly let the air out and listen. Okay, now okay, now my readings were, I think, about 115 when I said now, and then the second break was 60. So I'm within the range. I know from experience in the past my blood pressure has been about 100 at the top number and 60 at the bottom number. Again, 100 is systole, the ventricle pumping pressure, and 60 is the diastole, or resting pressure. Okay, the next step is I'm going to smoke a cigarette and see if there is a change in my blood pressure because of the smoking of cigarettes. Now, I'm unexperienced at this, so if I cough, don't laugh. And I want to make sure that I inhale it into my lungs. Okay, here we go. That's one. Don't try this. This is terrible. Okay, here's number 2. I wonder if this is how they make TV commercials. Used to make TV commercials for cigarette smoking. One more. I'm getting lightheaded a little bit now from smoking it. That's 3. I'm pretty dizzy right now. That usually happens to a non-smoker. I already see some, here's some little tar and stuff that's built up on the filter already. Let me zoom in, you can see that. You can see there the discolored, that is usually a white tip, and now it's kind of brown and yellowish color. So let's go back to me. Okay, here comes number 4. You will listen, won't you? That's number 4. It's getting to me, gang. Okay, here's number 5. I'm going to stop. Okay, I'm going to go off screen here for a moment to put the cigarette out. Here, and I'm inflating the cuff now. Watch the meter needle move up to about 140. Now, one thing that cigarette smoking does is it almost immediately causes your blood vessels to constrict. They become smaller in diameter, smaller. Whoops. Mistake. The cuff is sliding off of my arm here. I have to start again. Sorry. So great. Came apart. Okay, let's try one more time. Thank you all for being patient. And stethoscope back into my ears. And let's try it one more time. The band around my arm is beginning to fill up now. I'll go up to, try to get to 150. 160, and now I'm going to slowly let the air out. Now, I can now hear the pulsing of my blood vessel. Start about 130. And let's now find diastole, the lower number. Right there, 80. So, within a few minutes after smoking a cigarette, the systole, the larger number, my ventricle pressure increased to an amount. Make sure you have that marked down. As well as my diastole, or resting heart pressure, increased. Now, with a little subtraction, subtract the difference between the two systole amounts before and after smoking a cigarette, and do subtraction 2 for diastole before and after smoking to determine how much my blood pressure increased within a few minutes after smoking a cigarette. Mark that amount down at this time.